need something to hold this.
We have to memorize that chart, right, on basically when you should do repeat radiographs depending on the severity of
Yes.
risk.
Yes. The ADA chart, yes.
Yeah.
And then also pay attention to the difference between if it's just the ADA or if it's the ADA Canberra modified.
Because there's a chart, and then like for the quiz, I was doing it yesterday. There was a chart, and it didn't have moderate, but then there was a flow chart a couple slides down that included like the moderate risk guidelines.
That's the Canberra.
Okay, that's Canberra,
Yeah.
and then the ADA is the table.
The ADA is the table. Yes.
Because when we apply the ADA versus the Canberra, is the Canberra just a more in-depth version of ADA, or?
Canberra is more specific just to restorative because it's just related to caries. And we've used that because restorative dentistry department here adopt that in the clinics. So just so you know exactly.
Because the two.
But the ADA involves perio, caries, edentulous patients. So it's a broader picture, I guess.
Because out for the quiz, using the table, the top one for the ADA, like partially edentulous risk for caries isn't like super high, but increased risk for caries is 6 to 18 months. Or if I scroll down a few, I go dentate or partially edentulous, moderate risk is 18 to 24 months.
Yes.
So that was like, these are two different timelines that describe the same patient. So I was curious, like, which one do you want us to refer to if you ask a similar question?
Wait, say that again.
So for the quiz, it was a partially edentulous patient that had risk of caries.
Yes.
And for the ADA, it's 6 to 18 months for partially edentulous and risk of caries. And for the Cambria, for the same thing, dentate or partially edentulous, moderate caries risk is 18 to 24 months. So instead of, it's 16 to 18, 6 to 18, or
Yes.
18 to 24.
The question will tell you if it's based on ADA or Canberra.
Oh, okay. It'll say specifically
Yes,
ADA.
it's based, yeah. So
Okay.
read the question.
Okay, question will
They don't just
specify.
have moderate risk, they just have increased risk or no risk.
Yes.
That's true.
So I think that's why restorative prefers Canberra because it's a little bit more specific.
But moderate risk would be considered some sort of increased risk.
Yes. I agree.
And just a reminder for this,
There was
Canberra.
a question in the back, sorry.
And just to confirm, we need to know both the ADA and Canberra, right, those charts?
You have to know both, yes.
Okay, and then my question, so for like today's content, would we, is it gonna be more like a first order question, what kind of things we look for, or is it gonna be like a radiograph diagnose what is this?
Mostly it'll be radiographs.
Okay.
I cannot tell for sure. I don't remember if there is any question for new material without a radiograph.
So,
I want to say that 99% of the time, there will be an attached radiograph to the question. So it's pretty much either what is this
yeah.
or what could not be this.
So of the 40 new
Just
questions-
read if there is a not in the question.
Yeah.
Yes.
So of the 40 new questions, most of everything's gonna have radiographs?
Yes.
Okay.
I cannot promise now 100% of the questions will have a radiograph,
Yeah,
but I think most of them will.
okay.
I cannot give you the percentage, but
Sure.
usually when it's diagnostic part,
Yeah.
I always put an image because that's what you're gonna do in the clinic.
There's like a good 10 or 15 slides worth of like axiom pictures,
That's for your clinical information,
not for the test.
not for the test. I'm not asking axiom questions.
I was
on
gonna
the
say,
test.
I'm like, I don't know if you could, but that could be.
That's like real life, kind of. Yes,
Canberra versus ADA guidelines, what do we use in clinic, in reality? Or both, or,
both.
okay,
But for caries, you use Canberra.
okay.
But in all the other clinics, you use the ADA.
And
On
thinking,
the board exam, the INBDE, you use ADA.
and we don't, there's no law requirement to follow these per se, it's more, organ
It's
laws.
a recommendation.
It's a recommendation.
Yes.
But organ law is everything we actually have to follow.
Yes.
100%.
Yes.
For our dental anatomy part for the maxillary sinus versus the zygomatic bone, how would we differentiate the, what's it called? The lower border, the bottom border of the maxillary sinus?
The floor,
Yeah, the floor of the maxillary sinus with the zygomatic process. Like,
so the zygomeric process has a UVJ shape. The radiopaque line is usually thicker, and then it goes up. So because the zygomeric process goes all the way to the frontal bone, so you see it more like a UVJ shape.
So in all cases, that would be the case, where if you see that J shape, that's a zygomatic process. Like on the test, you're always gonna be the case.
Yeah, but the floor of the maxillary sinus, if you're just seeing the bottom, may have that curvature as well. So it's kind of, it's, yes, I guess. The answer is yes. But it's more like the location, the shape, the thickness of the radiopaque line. And then the zygomeric process is just there, so you don't see anything anterior to that. And the floor of the sinus is a continuous line.
would the floor of the maxillary sinus, would that dip down into the roots of the molars?
It can.
It can.
Yes, the sinus can be as big as they want. So they may be not touching the roots at all. They may be just at the apical level. They may go all the way down between the roots. So different people have different sizes for the sinus. But most of the times, the walls of the sinus are a very thin radiopaque line. And then in anatomical landmarks, we have a thicker line. Yes.
So the difference between horizontal bone loss and disuse atrophy is the presence of a tooth or not?
Yes.
So if you have some sort of bone loss, but no tooth, you're gonna say disuse.
Yes.
Okay.
Correct.
And then will there be any intraoral clinical photos included on the exam, or are we just going straight off radiographic images?
I don't think there will be any photos. You may
Okay.
have questions with clinical information.
Okay.
So on the question topic, for example, I may say, the tooth tests are not vital, which means that the pulp is necrotic. So
Oh, okay.
there will be a part,
Yeah.
so something like that.
Okay.
So read the questions. They are not long questions, they're very straightforward, but if there is any information on the question, use that because that may change your diagnosis.
Okay.
Do you remember if this third test is historically more difficult or more lower scores for students? Do you remember? Or about the same?
So what I noticed is not related to the test, is related to it when the test is in the final. I had that before on the Friday, which means the last exam. It was terrible. It was like people didn't perform as well as if it's in the beginning of the week. Because I was a student not long ago, so I remember that sometimes we review the material, what's coming next, and then if it's in the beginning of the finals week, you have the entire weekend to do it, kind of like.
Okay.
If it's Friday, you're tired of the entire week of the exam, so it may be harder.
So you'd say it's about same difficulty?
Yes,
Or?
yes.
Could you describe the difference between dehiscence and fenestration?
Dehiscence and fenestration. Dehiscence comes from the CJ level down, and then it's like a window that is exposing the root. Fenestration is a hole on the alveolar process, but not connected to the crest. It's more kind of in the middle or apical portion of the root. You don't see dehiscence and fenestration on 2D image because it's overlapping with the root, so it's more like a cone beam 3D image.